Back to systemic lupus erythematosus, SLE. Here are just some ideas of where there are connective tissues and where these people can have struggles. Signs and symptoms of SLE. No two people are going to present the same, which is what no textbook picture means. Classic feature that will identify at least that clue that we should test them is a butterfly rash over the bridge of the nose. It's raised in red. It might be itchy and it'll come on like it's not like they've had it their whole lives. These patients can be photosensitive. They can have ulcers, arthritis, pericarditis. They can have urinary infections, all kinds of things, just depending on where the connective tissue is inflamed and exacerbating. Diagnostic tests, they're going to do a skin biopsy. They're going to do an ESR, erythrocyte sedimentation rate lab. Anti-nuclear antibody titer will be positive. There are no labs that definitively diagnose this disorder. It's kind of signs and symptoms and a lot of different things. ESR, like I said, will be increased, but it's not specific to any disorder, so it could be increased for other reasons. ANA is an autoantibody found in the blood of people of rheumatoid arthritis, systemic lupus, so chances are that they could have SLE. It's treated with cortisone on the skin rash. Plaquenil is an anti-malarial drug that helps with it. NSAIDs, steroids, sometimes Imuran, different chemotherapeutic agents to suppress the immune system. It just, like I said, it depends on what the issues are. Biggest thing this patient's going to need is emotional support. They're going to have to be validated in sometimes they feel great, sometimes they don't. And that isn't, all in their head, as lots of people like to say. And if it progresses, it turns into scleroderma. And at this point, I am going to skip slides. Actually, this is the last slide that I'm going to talk about. The rest of them, I highly encourage you to read. Connect the slide with your textbook, but between the notes that are below the slide and the slide itself, you will have all the information you need to be successful. Scleroderma is Greek for hard skin. Scleroderma is not a big deal if you have a little spot on your face, but if it covers your chest cavity and you can't breathe, it's a bit of a problem. Antibodies damage healthy tissue. That results in inflammation, and then collagen's overproduced. That's how it happens. So the rest of the slides, so 75 through 87, like I said, I'm going to leave those on your own for those. There's great information on those slides. You might want to add a couple notes from your books, but that should be plenty of information, certainly for this course and for the boards also. So this ends the muscular skeletal presentations.